Okay, good morning students. Today I'll see about DT-based video. Okay, in stroke, how to apply the design thinking 5 phases. It's a empathy phase and ideate, define, and prototype. Finally, you'll go for evaluate part. Okay, so this class will tell DT-based will tell about Akash and Emmanuel Benjamin Thomas. Okay, start with the class.
Hi everyone, today we are going to see a DT based video on stroke. Okay, let's see the empathize. Empathize is something that empathize the patient with the deep meaning of the patient's condition. Okay, Akash, let's see the empathize part of the patient.
Yeah. So today we are going to see about stroke condition. So he was affected with right side hemiplegia. That is, he has a left side brain lesion due to lack of blood supply to that area. So he couldn't do his functional activities and ADL due to his flexor synergy. So he was currently in spastic condition. So his range of motion and joint movements are reduced, and his muscle tone was increased like hypertonicity he was.
Yes. Next, let's see the define. Define part is something that defines the whole part of the condition in a single line. Okay, how will you define this condition?
Yeah, now we can see about stroke. We have right side hemiplegia, that is, he was affected with stroke in a left side lesion, brain lesion. So due to lack of blood supply, it can be of two types, like hemorrhagic stroke and ischemic stroke. And ischemic is a lack of blood supply or a reduced blood supply to that area, and hemorrhagic is a rupture of blood vessels, and that is also meant by decreased blood supply to that area. So that it was. We have four cortex like frontal, parietal, temporal, and occipital. And which cerebral cortex is affected, like which is part is getting less blood supply, he will affected with that conditions. Like frontal, he will lose his cognition and movement disorders like conditions. So he was with right side hemiplegia. And in stroke, it also has one type like transient ischemic attack. It has 24 hours of these symptoms. We should administer him with a TPA, that is tissue plasminogen activator, or statin to get out of this condition.
Thank you, Akash. Next, let's see the ideate part. Ideate part is the part where we stimulate the solution for this. Okay, Akash, how will you diagnose this and stimulate the solution?
We can see his gait abnormalities and posture and his deformities. We can have a outline of it, and we can go for MRI, CT for concluding it as a stroke. Like we can take a brain MRI and see a ischemic area or a hemorrhagic area he was affected with.
Okay. Next, see the prototype. How will you follow up the protocols based on the clinical features of the patient?
So first, I already told that if it is transient ischemic attack within the 24 hours, the symptoms is last. We'll give, and also for a stroke condition, within 1 hour we will give tissue plasminogen activator and statin for blood coagulation, and after that we go for medications for stroke, and we can either go for a surgery too. And in PT management, we will start with reducing the spasticity, or we can get a PT management about his stages of brainstorm classification. Like if he has flaccidity, we can go for quick eyes from distal to proximal, or if he has a spasticity, we can go for slow eyes from proximal to distal. So like this management will varies, and we can gradually have stretching and motor relearning approaches like weight shifting exercises and trunk PNF techniques for get rid of it, and we can progress it to passive movements.
Yes, Akash. Next, let's see the evaluate part. What is a hypothetical prognosis of this condition?
If we have a acute stroke, we are treating an acute stroke within 2 to 3 months. We can get a very good prognosis. If it was a chronic stroke like conditions like about 1 year, so the prognosis was little low when compared to the acute stroke. So how early we are treating the patient with both clinical or PT management is that beneficial for the patient to have a better life.
Okay. A particular time period for the recovery.
Yeah, that is only acute stroke. We want to treat 2 to 3 months. He will get rid of like nearly 3 months.
Nearly 3 months is okay enough. Yes, Akash, as we discussed from the prognosis, as a community member, I will hear about something related to stroke. Be fast.
Yeah, PFAS is a warning sign of stroke, and it stands for like B for balance disorders, and I for muscle weakness, and F for facial drooping and drooling of saliva, and A for arm, both limbs and arm, especially the arm weakness, and S for speech disorders, and T for time to emergency. And in medical management, if it is, these signs are for ischemic stroke, and if we are ischemic stroke, we can go for thrombolysis treatment, and for hemorrhagic stroke, we have go for surgery, and for the chronic condition, we can go for craniotomy or craniectomy surgeries. And in PT management will improve the quality of life of a person affected with stroke.
Yes, thank you, Akash. As with your explanations, I get an overall idea about the stroke based on the DT. Okay, thank you everyone for watching this video.